Good to have you with us in this Monday edition of the Urban Debate. Viewers, tonight we begin the special broadcast with a focus on the vaccine for COVID. Now, while yes, we still don't have a vaccine, many research development processes are inching closer to finding the right vaccine. Several of these projects are in their final phase of trials across the world. Back home in India, our own Serum Institute has actually partnered with 5 different global firms and is researching, developing, carrying out trials at multiple stages. Our own Indian trial has entered phase 2 after some good positive response in phase 1 as per the initial feedback. But that's not what I want to talk about today. Yes, we've told you repeatedly that finding a vaccine may take time. Everybody hopes it will be by the end of this year. It could be by next year. We don't know when it will happen. But viewers, what about that? Often what we believe and what I've observed many around me believe is that once the vaccine has been discovered, life will be back to normal. Everything will automatically fall back into place and all our problems related to COVID will go away. Well, I hate to break it to you, but if you believe that, then you're highly mistaken. Even once, anywhere in this world, a vaccine is discovered, it's a long road ahead. Let's just take our country for example. Let's talk about you and me. A population of over 1 billion people, 1.3. Imagine how long it will take to ensure everybody gets vaccinated. Imagine producing these many doses of the vaccine just to cater to our own country. Imagine the kind of investment that will go into building the facilities, manufacturing facilities to manufacture this medicine, the plan that will be required to distribute this medicine, and how long it will take. And now, I will ask our experts to help us understand this. It's not going to be overnight, that I know. How long can it take? 1 year, 2 years, or more before everybody in our country actually gets vaccinated? How much money will it take? Now let me give you an example. Adar Poonawalla of the Serum Institute tweeted a couple of days ago, and he said that the health ministry will need at least 80,000 crore rupees. 80,000 crore rupees to ensure that everybody in India gets vaccinated in about a year's time. And we need a plan. The government needs a plan for manufacturing, distribution, and vaccination. What kind of plan should we be working on? We do know a panel has been set up. We do know conversations are on. But are we moving too slowly? All of that is what I'm going to discuss here tonight. We start with the basic premise that even if tomorrow we find a vaccine, how long before you and I and every single person in this country is able to get it? So good evening to our panelists who are joining us right now. Dr. Abel Lawrence, Professor for Clinical Immunology and Rheumatology at SGPGI in Lucknow. Sujata Rao, former Health Secretary with us this evening. Dr. Ramanan Lakshminarayan, Affiliate Professor for Global Health at University of Washington. Dr. Sylvia Karpagam, Public Health Doctor and Researcher. Dr. Sakir Ahmed, Assistant Professor for Clinical Immunology and Rheumatology with Kalinga Institute of Medical Sciences. Hello and welcome to everybody with us right now. Let me actually start with Dr. Abel Lawrence. Dr. Lawrence, can you help us understand, usually for a mass immunization program, how long does it take for us to at least ensure that a large percentage of the population gets vaccinated?
First of all, as you rightly said, we will not be having enough amount of vaccine to give everyone. But that is a moot point. We cannot start with everyone. The vaccine will naturally be prioritized to high-risk individuals, people at the front line of the COVID fight, who have been risking their lives, contact tracing, Lots of health workers, policemen, so many people are involved in COVID duties. I would say that we doctors who treat patients, we have PPE. There are a lot of people who do it without PPE also. So all the frontline workers, including medical personnel, naturally get this vaccine should get priority. And then as the safety is proven, then only it should be expanded to wider section of people. So we need to look at the risk benefit of the vaccine versus potential adverse events. When we give to crores of people, let's say 100 crores, we cannot accept even rare side effects. So the single instance of transverse myelitis that was reported in the news should make us be cautious. It should be rolled out to the correct people or steadily, and as the safety is proven, it can be expanded in an exponential manner. That answers the question. We cannot have the vaccine immediately, and we should not be having the vaccine immediately. And Serum Institute can produce, as I understand, 10 million vials a month. And if it is safe, the production size can be increased, and we can co-opt other vaccines which are available. So all of this depends on the safety data and the efficacy of the vaccine. Suppose if the data says the vaccine is not sufficiently efficacious, then it cannot be rolled out. Things will go back to drawing board, and next generation vaccines. Eventually, I'm certain that the modern science has the wherewithal to develop effective vaccines against the COVID. It's a matter of time. How soon, we will find out.
Okay, so let's take it step by step, and let's carry forward the conversation from where you've put it, and which is to say that, even if we find a solution for a vaccine, how do you begin to put it out? We shouldn't give it to everybody immediately. What if, the impact isn't the same as what is expected? Dr. Ramana Lakshminarayan, would you want to come in on this? What should be the pace of rollout? Do we first start with our frontline, COVID warriors, the doctors, the frontal medical staff, or even our law enforcement agencies?
So, Tanvi, that's a really good question. I'd like to echo everything that Dr. Lawrence said, which is if it's not an extremely safe vaccine, it is not ready for anyone in the country. And I think that is the first bar. I think the added part is first about efficacy. Efficacy of vaccine can range from anything from a mid-40s, which is the current malaria vaccine, to as much as 85, 90%. No vaccine is 100% efficacious. So it remains to be seen which vaccine, how efficacious it is. Now, there are a number of vaccines in phase 2, phase 3 trials. I think you described them. And some of them are from within the country, some are from outside the country. It is not yet clear which of these vaccines will be proven under which circumstance. For instance, children are a vulnerable group, but we may not have a vaccine that has been tested against children. Only one of the vaccines or two might actually be testing on elderly. All these are vulnerable and very different populations. So I don't think we can assume that the first vaccine that arrives, that we give it to frontline health workers or to the elderly or whatever else it is. I mean, I think the doctors will be, first in line, but I think at the end of the day, we have to make sure that the vaccine is so safe that we're not using anyone as guinea pigs when we're rolling it out. I think this is going to take a lot longer than people expect, and it's going to be a lot more expensive than people expect. As you correctly said, 80,000 crores. This is about twice India's health budget right now, and the question of whether we can afford a number like that to vaccinate every year the entire population is an open question. So lots of questions about vaccines, and I think I've been saying, like others have, that let's not look at this as sort of a panacea and as something that is going to rescue us in any short period of time. It's a long road ahead.
Well, it's a long road ahead. That's the point that I would like to emphasize on again and again, because I feel that no matter how much we say it, I think it's the hope within people that makes them believe that, maybe this time next year we will all be fine. We would have found a vaccine or a treatment drug, and we can go about our lives without having any kind of COVID concern. But let me take up from what our two experts have said and take it across to Dr. Sakir Ahmed as well. Dr. Ahmed, do you agree that we should take it slow And even once there is a vaccine that's been discovered, how do you believe it should be rolled out in our country?
I completely agree with the other two. Uh, the first concern is safety. If you look at medical ethics, we should not do anything that is likely to harm. Some of these vaccines are using technologies which have not been licensed yet for general use. Suppose the Oxford vaccine that is using a non-replicating adenovirus. So it is basically a virus which infects animal. It has been modified to carry certain genes of the COVID virus so that it can produce immunity in humans, but not replicate. That is, it will not multiply and cause disease. Such vaccines have already been tried for HIV, and we did not have much success there. Though these work well in animal models, initial phase 1, phase 2, they seem to work, but in the actual efficacy trials, they do not work. So we have to be really careful, especially using vaccines which use DNA or RNA-based technologies or the adenovirus carriers. And once we are sure of the safety, there are other issues also. We can just have a look at the polio vaccine. Polio vaccine has been there for more than 60 years, but it took those 60 years to get rid of polio, to eliminate polio throughout the world. Because it is not just the economic issue, there are also social issues involved. There was plenty of resistance administering that vaccine to a lot of people. And that was an oral vaccine, and this is going to be injectable. There is likely to be more resistance to an injectable vaccine also. And if there is news of one major side effect affecting 3 or 4 more people, then it may spread a false message among the people, and people might get really scared of it. So we really have to be careful. One is we are not causing harm, and second, the wrong message should not go and should not frighten the people.
You know, that's a very interesting point that you've made, Dr. Ahmed. And Dr. Sylvia, if you would want to come in on this as well. People need to understand this. That first, it took us several decades to find a vaccine for polio. And after we had it and we launched our entire immunization program, it still took us such a long time to eradicate polio completely. So we need to all understand this, and people need to understand that just finding the vaccine isn't the end of our problem.
Hi, Tanvi. Thank you for inviting me on the show. I think before we even talk about who is going to receive the vaccine, I think we need to also get a context in terms of the situation of vaccines in India. We have a lot of vaccine preventable diseases as part of the national program, immunization program. And even among those vaccines, the coverage is not as good as it's supposed to be. There are a lot of pockets who get left out, and tribal areas, vulnerable communities who are not being reached even by the existing programs. And with the pulse polio, what we've seen is that we have limited human resources, we have limited infrastructure. And what happens when one disease gets the focus is a lot of the other disease get left out. So polio might have been eradicated, but I don't think anyone's really looked at what's happened to measles or mumps or rubella or tuberculosis. I mean, tuberculosis is a huge cause of concern, and what's happening to the BCG vaccination. So I think there's a tendency to romanticize certain diseases, and this rush for vaccines so there is also a culture of fear, and people are really apprehensive, and there is this false idea that is being created that the vaccine is the kind of solution to all the problems. We need to also understand that historically vaccine trials in India and there is a global mafia that is in place in terms of manufacturing vaccines, pushing it. What is not just the side effects of a COVID vaccine, but what is the consequence of COVID vaccine being pushed, say, on malnourished children in India, on anemic pregnant women, on women who have a lot of other complications, on elderly who are having not having enough to eat. None of those things are being taken into account. And there are like a lot of other things that are being set aside. For example, what's the role of nutrition? A lot of doctors are saying that obesity itself is a huge side effect in the sense that it increases the complications due to COVID. But then that is not something the government wants to talk about, because the long term, the sustained solutions may not necessarily be a vaccine. And we have a history of, like, for example, we have the human papilloma virus vaccine, which it was an unethical clinical trial. We also do not have enough legal mechanisms, and in fact the ICMR and the WHO actually redefining some of the definitions which are actually dangerous. So they're saying if you like, for example, companies asking for an indemnity clause. Basically, if you get a vaccine and if you get a side effect, if you die, if your child dies, if your parent dies, there's no one you can go and sue, because the pharmaceutical company has been protected by an indemnity clause. And also the definition of what is an adverse reaction. Basically, they're saying there should have been previous epidemiological evidence that this vaccine caused the adverse reaction. So if it's clearly caused, like if a child gets a vaccine or if an elderly person gets a vaccine and develops a complication or a side effect, there's no way you can go back and say that it is because of the vaccine. And the other point that we have to remember is it's 1.7% fatality, which means the rest of the people recover. So we really need to have conversations on whether there's really a need for vaccine. And more importantly, what are we not doing in the process of this? Like, you're talking about crores and crores of budget for this vaccine. Who's going to benefit? Is it really the people? I think those are the questions that have to be asked.
Okay, and we'll take them one by one. And before I go across to Sujata Rao, on the planning and the government's role on it, very quickly, Dr. Ramanan, if I can come back to you. If you say we need to take it slow, we need to see who we administer it to, the initial round impact on people. So can one then assume that perhaps the elderly or the children or those who would otherwise need more strength to fight COVID shouldn't be the ones who we give this medicine to? Shouldn't it be somebody with a stronger system to first try the medicine on?
We don't know the answer to that, because it really depends on the age groups in which the vaccine is actually tried out. These vaccines will all have different roles to play, right? So some of them may be better at preventing severe infections. Some of them may be better at just preventing infections, period, not just the most severe cases and hospitalizations. For these different vaccines.
Okay,
the cold
fair
chain
enough.
requirement is vastly different.
Yes, go ahead, please.
So I just think we're in a hypothetical space here, Tanvi, and I think that we just don't know the answer to your question, and that's really the honest answer.
In fact, yes, because what you pointed out, let me also explain this to our viewers, that even now, for the many of the trials that are going on across the world and the initial data for each of these trials that has begun to emerge, some of them seem to be working better on a certain age group, but not on the others. So those that may be getting a strong response from the mid-age group, volunteers aren't getting the same response on senior citizens. Those who may be working better, in people from one geography may not actually have the same impact on people from a completely different part of the world as well. So all of those things will also have to be kept in mind, which is why Dr. Ramanan is saying that too soon to really say which way it should go. Sujata Rao, thank you for patiently waiting. Let me begin by asking you this one, question that's on everybody's mind, especially since Adar Poonawalla tweeted saying, well, the government is going to need 80,000 crore and an exhaustive plan for manufacturing and selling of this medicine. Can you help our viewers understand the mammoth task that it will be? And at the end of the day, it has to be the government that steps in somewhere as the sponsor for this vaccine, or do we simply expect the private players to do it?
There are different aspects to this issue. But anyway, you've raised the financing of the vaccine. Clearly, government of India right now, given the economic conditions, will never be able to afford 80,000 crores. So that question doesn't even arise. What I visualize will happen is by the middle of next year, we'll have more than one candidate vaccine, which would have shown some amount of reasonable efficacy and safety. And it might create, if all goes well, and there are more than 3 or 4 vaccines, it might create a competitive environment. And when government steps in to say, I want to procure in bulk, prices crash hugely. Now, so that is one hope that we have, that the prices will really crash. And there's enough evidence around the table to say how much hepatitis B used to cost before, when government entered into the market, how much it costs today, and so on and so forth, including pentavalent vaccine or any vaccine that you might say. So we buy at an extremely cost-effective rate because of the huge numbers in which India buys. The second is, let us assume it's a monopoly item, and there's only one vaccine that is available to procure. First of all, there will be a lot of international arrangements that will come in. The WHO will definitely step in. They will try to negotiate with the vaccine providers, manufacturers, and try to get the best price for all the countries to buy. But let us leave the world around. Let's just only look at India. If that happens and there's just one supplier, maybe Poonawalla, and we need it, we have the option to declare it as a national emergency and do compulsory licensing and take over the vaccine and distribute it among our manufacturers to manufacture more of the vaccine. Or keep a price cap, like the type price caps that we have been doing for stents and drugs and so on. So that, if we can arrive at a negotiated fair rate where it is much more reasonable, then it will become a more affordable case. Having done that, once a price is fixed, it is not going to be possible. Like Australia and all are willing to and planning to give it free of cost, but I don't know if India will be able to provide it free to all the 1.3 billion people. I think it will give it free of cost to the government providers, caregivers, to all the poor people. That's about 500 million of them will get it free. But the rest may have to buy it in the market and get reimbursement from insurance, perhaps. In that scenario, also, it will have to be affordable so that the middle classes or the upper middle classes can be able to take avail of it, So this whole pricing issues, there are large number of options available, whether we pay out of our taxes, whether we borrow money from the World Bank, or we get ADB to give us a loan, or, Gavi might be stepping in. Gavi is funded hugely by Gates Foundation. So once the vaccine is available, and we know the frequency with which the vaccine has to be administered, what is its efficacy? Is it going to be lifetime, or is it going to be every year requirement, and so on and so forth? So many imponderables are there on the vaccine. Then the pricing issue will really step in. So that's one big aspect, but I cannot imagine government of India setting apart 80,000 crores to provide this vaccine to everyone. I will be immensely amazed. Secondly, the rolling out, the logistics are hugely going to be challenging for government of India, even though in India we are in a better position because we have huge experience in doing mass vaccination programs like for polio, and starting with smallpox right down to polio. We've been very, very successful in making a polio vaccine, for example, available. But then they were only children, and it was just 150 million people. Now children, now it's a whole population. So here it's going to mean maybe doubling our cold chain capacity to keep that many vaccines there. I don't know what the cold chain demands of this vaccine will be, what temperature requirements will be, and that servicing of that cold chain, the people have to be trained, and particularly if it is is it intradermal, what kind of injection it will be. All that requires the manufacture of those injections and so on and so forth. So there'll be a lot of manufacturing demands, there'll be a lot of training demands, there'll be a lot of logistics demands of supplying these, having refrigerated vehicles to transport these vaccines to the place. It will take a long time. It will take at least a minimum of 6 months by the time the last man gets it. And that's a good scenario. It might even take longer. So there are logistical, operational issues on the one hand, which I believe we should begin to look at right now. It takes a long time to get our vaccine cold chain into full shape, and I don't know if we are working on that, but we should, and the training requirements. And second is the cost financing aspect, which will be quite a challenge for government. And then the third, of course,
okay,
is
a follow-up question, and I start with you. Yes.
Yeah. You want me to continue?
So Ms. Rao, let me ask you this question. You say that, we need to do preparations when it comes to manufacturing, the cold storage, the logistical part of it. Perhaps we should start now. The Zydus Kerala, official was quoted recently in a newspaper story saying that if India wants to vaccinate everybody within the first 1 year, we will have to set up additional manufacturing facilities that would require 3,000 to 5,000 crore just in setting up those new manufacturing facilities. So is that something that the government needs to start planning right away? And does the government put in that money, or should that be then given out to private players?
No. I mean, the government has just 3 or 4 of its own vaccine manufacturing concerns. I don't know if they'll be able to shift the entire. You have to remember one thing. As it is, the vaccine manufacturing capacity is is only with a few people. It's not everybody can manufacture a vaccine. And it's not as if only COVID vaccine will be manufactured. There's all the other menu of vaccines. Our entire immunization program has to continue to be also manufactured. So the manufacturing capacity has to be increased, doubled or trebled. And it is right now for the government to sit with these vaccine manufacturing companies, whether it is Serum, whether it is biotech, or whether it is Zydus, if it's getting in. Whoever is getting into, who has a technology and ability, must get into a dialogue and start building up their own manufacturing capacity. Also remember, if our vaccine, India's vaccine, turns out to be very successful, there will be a huge international demand for it also. So, there is a manufacturing capability internationally itself is limited for providing a vaccine at the same time for the whole world. That's not possible. So therefore, manufacturing capacity is one thing, our own logistics capability within the government, though right now we are well positioned, but not for the scale at which we need to prepare. And I think this must be taken up on a mission mode right now as we speak. We are already late, I believe. So I hope that government, I'm sure they are working on it.
Yes.
And these are issues that need to be flagged and worked upon systematically. Yes.
In fact, we don't know the exact update on it, but I must tell our viewers that yes, there is currently a national expert group that has already been constituted. Prime Minister Modi himself is tracking, their meetings and their conversations and their work very closely. This is being done under the leadership of Dr. V.K. Paul, who's a member of our Niti Aayog. And so they're not just looking at, vaccine selection, but procurement, delivery, logistics, risk management, financing, stockpiling. All of this will come under what they have to do and the plan that they have to make. But yes, we don't know the exact updates of where that plan has reached. Obviously, the government is well aware of the challenges which are present. Let me go across to Dr. Zakir Ahmed on my next question then. Dr. Zakir Ahmed, if we are saying that we need to invest so much in creating additional manufacturing setup, can that be done in advance? Or won't we have to first wait to see who finds the vaccine, in which part of the world, before we start preparing the actual on-ground, manufacturing logistical support?
That is a difficult question, but it will depend also on the type of vaccine that will ultimately be selected. But there are a few things like maintenance of cold chains, the places it will go and how it will go. Those can be worked out well in advance. And as Madam has said, there are already immunization there is a network for the national immunization schedule. Vaccines are being made and sent to various centers across the country. So these need to be strengthened, and it can be worked on that. The US has what they call Operation Warp Speed, where they have utilized mostly people working on HIV/AIDS vaccine, plus they have brought in the private players, vaccine manufacturers, and they have tried to anticipate and plan ahead. Here also, the manufacturing in bulk has to be taken up center, and possibly then the others can follow. But the plan for distribution and logistics, that obviously can be planned well ahead.
Okay, and if you can also shed some more light on the possibility that just getting vaccinated once may not be enough. We don't know yet for how long that vaccine will have an impact on people, but there is a possibility that we will need multiple doses.
Yeah, most of the vaccines in trial now, they require 2 doses. So in a country like India, it is difficult getting a person vaccinated once. Will we be able to vaccinate them for the second time? That also possibly within a time frame. Then the second part of the question is, how long will the efficacy last? Again, we don't have an answer yet. And another important question is that suppose we choose one candidate vaccine, it has efficacy, say 60%. We launch it all over the country, and 3 months into the program, another vaccine comes in which has an efficacy of 90%. So do we change there? These questions are very difficult questions, and I don't have the answers. I don't think anyone does.
That's a very interesting point you've raised. Dr. Lawrence, would you want to comment on that?
Sakshi has raised it. That is why you have to go cautiously, step by step. Initially, prioritize the highest group who will benefit early from the, and then as we get data, we can adjust, respond to the situation, respond both to the any response, adverse events, efficacy, the market situation, cost, etc., and adapt instead of planning to vaccinate the entire population in one go. So basically, this is a fast-changing area. The COVID itself is something which is having new developments every month. And the vaccine area was also very interesting. Nowhere, not at no time in the history of the world has so many people, so many companies working on vaccine against a single pathogen at the same time. And so many, different types of vaccines are. So this is a great experiment by the whole humanity. So I'm saying that we will have a vaccine. We will have an effective vaccine. The question really is whether the first generation vaccines are the best one, or the second and the third generation vaccines will be better than this. So we cannot, we should not be jumping the gun, and our government has cautious, and it is correctly so.
So again, because you're all right now advising that we need to exercise a lot of caution, we need to have a clear plan how it goes out. Will it be then right to assume that then that's something that the government needs to decide? And so those who may have fears of when the vaccine is discovered and is out there in the market, how do I get my hands on it? What kind of money will I have to pay? Will I be able to get it in black? Or will it be out of supply in my city or in my town? How will I get my hands on it? For people who are wondering this, how do we, make them understand, Dr. Lawrence, of the process that will be in place once the vaccine is getting manufactured?
We need to communicate to the public so the public does not have false hopes. As well, the public should have correct information. We have to publicize who are the risk category, who are likely to benefit, what are the risk factors, and therefore, so that will avoid panic. People, if the reason people want to jump ahead is because they think this is a panacea for everything, that if you get a vaccine, you have a passport for everything. It's an unknown thing. So depending on the safety, we need to give the information so that there is no panic, there is no black marketing, and the right people with the maximum risk and potential benefit get it first.
Okay, Dr. Sylvia, would you want to comment on this as well?
Like
what kind of
Yeah, and we are the
Yes, go.
mask. Let us continue wearing masks. Let us continue wearing masks. Be safe. Take protect measures. And even if we get a vaccine, we should still continue to use masks until this virus is conquered. This is not an alternative to wearing masks for now.
Oh yes, I think that's a very important point you've raised, and we must highlight that irrespective of when the vaccine is found and it hits the market, I think we should just accept the fact that for now, next few years, masks and sanitizers and general precautions is a way of life, and there is no other way around it, and that's something that we will have to inculcate and make a part of our lives. As long as we are in this COVID era. But Dr. Sylvia Karpagam, would you want to come in on this? The kind of policy that will be required to ensure, as the medicine gets manufactured, how it's distributed?
There was a statement put out in the first week of September by the Indian Public Health Association and the Indian Association of Preventive and Social Medicine, as well as the Indian Association of Epidemiologists, where they actually said there is no role for vaccines right now. But of course, there is a group that will benefit from the vaccine, and this we consider the high risk group. But it's important to kind of categorize this and not make, I think the others have also articulated, not make the vaccine appear like some panacea at the cost of other things. It's also important for the government to put out clearly where is a conflict of interest, who are these global companies, like what kind of contracts, because it's not just with vaccines. We are seeing with many other things. There is a entry of international players into Indian markets, and they come with an entirely business agenda. In fact, in 2015 itself, a report said that if you want to do clinical trials and if you want vaccines, then India is a good place for you to come because we have a virgin population. So basically, a virgin population is a population that hasn't had been tested with any kind of vaccines. So there is a lot of ethical issues involved, and I think the way the government has been handling it, the way the ICMR has been handling it, clearly they're trying to fast track a lot of these ethical concerns, and it's something they have to put out. And also, I think it's important to put out what are the side effects. People are not like dummies that you just go and inflict a vaccine on them. They need to be equal participants. They need to be informed players. They need to be informed stakeholders. So they need all information. If I I'm taking my elderly parent for a vaccine, then I need to know what are the side effects, and I need to make a decision based on that, whether I want the side effect or want the benefit of the vaccine. And that is not happening actually. There is like when the pandemic started, everyone was talking about testing without looking at, are we really do we have the capacity to do testing? Like if everyone's rushing to do testing, then something suffering in the process. Is quality suffering? Is regulation suffering? And the same with the vaccines. And the other thing is, I want to say that we are talking about frontline workers, and recently we've just been talking to frontline workers who are not your mainstream doctors and not nurses. You have people who are working in mortuaries, you have people who are cleaning the sewers, and people are cleaning the hospitals, people who are working in burial grounds. And they are, it's such a casteist kind of attitude of society and the health system to these workers. They haven't got vaccines to hepatitis B or to hepatitis A, and they are at risk of leptospirosis. They are at risk of malaria and dengue. So we need to be realistic about this whole thing of vaccine, because there's always a huge population in India, like the urban middle class, who kind of respond to this fear psychosis and who are ready to rush and get a vaccine, and they think they are protected. But I think maybe even without the vaccine, they would have been protected. So I think all those discussions have to be had, And before putting it out and before
In fact, Dr. Karbagam, if I may come in here, you raise an interesting point. And if I can take that point across to Sujata Rao, because let's also understand that even now we have this universal immunization program via which there are these set of vaccines that must be given. About 2.5 crore newborn children, babies, and about 3 crore pregnant women are given this set of vaccines annually. But still, a large percentage don't get it. A large percentage, 62%, only 62% of India's children have received all the recommended vaccines. So while we do have a universal immunization program, it's not obviously reaching out till every single last person in this country. Dr. Sujata Rao, will we have to think out of the box to ensure that the COVID vaccine reaches everyone?
I think we have the capacity to do so because we did it for polio. When it was one single item focused on polio, we had 100% of the children. It was an amazing, amazing amount of work that was done. It was not easy to get the last child into the polio vaccination in the buses, but going in boats to islands, in trains. I mean, name it, wherever the child was, they were vaccinated. Having said that, what Tanvi, at one point we need to remember right now, even as I say, that is going to be hugely challenging and we need 1.3 billion vaccines, and if it is twice a year, then it makes it even harder. At the same time, there is this whole thinking that there is a herd immunity, and by the time this vaccine really gets into the market, it is quite possible that the COVID pandemic may also, the caseload may reduce, and we might be getting into herd immunity, not really requiring the urgency may really fall, in which case the uptake of these vaccines by the people may be problematic. We found that happen in H1N1 in 2010, where we made huge arrangements to get the vaccine. And by the time it came in and was made available, all the H1N1 had sort of, the emergency or the urgency had reduced. And we found it very difficult for the frontline workers to take that vaccine. So there are a lot of imponderables, there are a lot of issues that have to be addressed on the vaccine, on the COVID virus itself. And I think every day we are adding to our knowledge and understanding better what this whole COVID virus is all about. And but then at the same time, no one can take a chance.
Right.
We have to work at the best scenario and work along as we move along.
Well, thank you so much for putting it like that. And I'm going to take those words, to wrap up this conversation. A big thank you to all the panelists who've joined us. I'm sure we'll have many more such conversations in our journey to finding a vaccine and then manufacturing and distributing it and carrying out that vaccination immunization program. Suffice to say, viewers, it's not going to be an overnight, process. Just like finding one drug for COVID isn't going to solve the problem for each COVID patient in this world or even in our country. Similarly, even if in one part of the country there is a vaccine, it doesn't solve a problem right away, maybe not even for a year or two, depending on what is discovered, in which part of the country, whom does it impact, benefit the most. The government will have to make a detailed plan. They're already working on it. But a huge amount of money, yes, crores of money will have to go into making additional manufacturing facilities so we can ramp up the production. We will have to come up with innovative, out-of-the-box ways to ensure how the vaccine reaches every single person. 130 crore doses of vaccine to be given in the first round. Imagine that mammoth task. Thank you so much for joining us on this conversation.